Good afternoon, everyone. Welcome all of you joining the public presentation organized by the Occupational Health Center. Today's the topic is about smoke and poor outdoor air quality environment, how it's related and affecting workers' health and safety. And we are so pleased to have the presenter coming from Ontario, Andre Gauvin. He is the occupational hygienist from the Occupational Health Center for Ontario Workers, Sudbury, to doing this presentation for us. So Andre is an occupational hygienist with the OCAL, with over 15 years of experience in occupational health. Andre is a graduate from Noventia University with Bachelor of Science in Kinesiology and a Master of Human Kinetics. He started his career in ergonomics and has made the transition to occupational hygiene a few years ago. He is board certified as both a Canadian certified professional ergonomist and as certified industrial hygienist. We would like to begin by acknowledging that we are on Treaty 1 territory, where the Occupational Health Center is located. The traditional territory of the Anishinaabe, Greek, OG Greek, Dakotas, and Diné peoples, and the homelands of Native Nation. The Occupational Health Center here acknowledges we are all treated people and recognize the history and impact of colonization on Indigenous people. We commit ourselves to active accountability, justice, equity, and reconciliation. So for participating this session, just please put your question and comment on the chat box area, and then we will try to answer it afterwards. You notice that this session is being recorded. We are going to share on our website and social media. I believe, Andre have quite a lot of great information to share with you. We may not be able to cover all the questions during the Q&A. Probably please connect with us, or maybe we will send you the answer after that to follow up. For some of the folks they're from Ontario or different provinces doesn't know anything about Occupational Health Center. We are the community health center funded by the Winnipeg Regional Health Authorities. We are now located on 167 Sherbrooke Street, Winnipeg, Manitoba. We provide the services to the Manitoba workers with work-related health issues and work closely with joint workplace health and safety committees for training. So our service is also free, and please visit our website for more information and resources. Now, please join me to welcome Andre for his presentation. I'm going to stop screen sharing now.
Thanks, Tiffany. I'll just share my screen here. You don't have it yet, eh? Hold on. Yeah, that's not the one I'm looking for. There we go.
Yes, all good.
Okay. So thanks again, Tiffany. Again, my name's Andre Gauvin, and I'm an occupational hygienist with OCAL. Just going to turn my video off here so that it's not so distracting. There we go. So I'm just going to start a bit by explaining who OCAL is. We're a non-for-profit organization. We're funded in 1989. It was originally sponsored by the Ontario Federation of Labor and then funded by the Ministry of Labor. We have an independent board of directors. It's mostly with labor unions as well. And OCAL is pretty unique to Canada. We're part of an Ontario prevention system, being partnered with 6 other health and safety associations, including 4 sector-based and worker training organization. as of now, we're funded through the transfer payment agreement as part of the prevention system of Ontario through the Ministry of Labor. So it's kind of funded through WSIB premiums and then going to the Ministry of Labor and then to us. So we have a multidisciplinary approach. So we have occupational hygienists, ergonomists, occupational health nurses, occupational health coordinators, occupational health physicians, and client services coordinators. And we work together to provide a solution to help your needs, whether it's with prevention interventions, knowledge transfers such as these, or through our clinical services. We try to help Ontario workers with compensation claims for their occupational injury or illnesses, and help improve or implement prevention initiatives for Ontario workplaces. So we have 7 locations across Ontario. So we have Thunder Bay, starting way up north. We'll go with Thunder Bay, Sudbury, Ottawa, Toronto, Hamilton, Windsor, and Sarnia. And as with us, our services are free. So feel free to contact us at any time or check our website, see how we can help you. So we're going to start, or what we're going to go through today is basically a wildfire smoke hazard assessment. So a couple sections here. So exposure measurement, then we'll get into exposure criteria. So what do we compare our measurements to? And then going into exposure prevention and control and what we can do. So just looking at measurement to begin with, you can get data just through your government website. So the Ministry of Environment has it in Ontario, looking at air pollution data. It's also useful during IAQ assessments to compare data from indoor and outdoor. And there's hourly measurements available for air pollution from these sites. So you have the Air Quality Health Index, which we have in Ontario as well as throughout Canada. You can get some data there. We have the PM 2.5 maps. Then you can also get raw PM 2.5 data, and then it'll kind of put it in tables for you. And then you can get graphs, and this is also, there's the Manitoba website as well for air quality shows this, and we'll go through a little bit of this as well. It'll show a 3-day or a 5-day graph, the 3 days in Ontario, 5 days in Manitoba for PM 2.5, and it'll kind of chart it for you. And you can also get historical data for the last year or two. I think it's 2 years in Manitoba. So just looking at the Health Canada website, so this is Brantford on June 28th. So it was pretty smoky in Southern Ontario at the time, and the government or the Canadian government actually added a symbol now for smoke, which wasn't there in the past. So as it's becoming more and more prevalent, they're adding these symbols to help us in our forecast. So looking at climate change, you know, it's basically a loop for wildfires. With climate change, you have an increase in CO2, which lead to higher temperatures and more droughts. Then this increases temperature, decreases humidity, and then there's no moisture, which creates a fuel for fires. So then you have fires that start and they become larger and more frequent. And then you end up with more CO2, which in turn increases global CO2 and increases climate change as well. So your prevalence for fires just become higher and higher as we have an increase in CO2 and drier and hotter summers. So this really is an unprecedented environmental exposure when you're looking at smoke. It's not something we see every year in some regions, but this year has been pretty wild when you consider the amount of fires that we've had in North America. So just looking at the June 7th of this year, 2023, this is what the map looked like for wildfire smokes and AQHI data. So looking at the dark purple, or more brown, I guess, dots, it's hazardous air. You don't want to be in those areas. Purple indicates very unhealthy air. Red is unhealthy. Orange is unhealthy for sensitive groups or vulnerable people. And yellow indicates a moderate risk, and green, well, is safe. So how bad was really the air? If you're looking at New York, it was probably one of the worst they've ever had. On June 7th, you look at, they had a peak of 868 micrograms per meter cube of PM 2.5. Then we're looking at June 7th. This is the map that I just had. Look out, and you can see how far the smoke, you know, it affected many parts of the world, not only North America, but it got as far as Europe here. And this is September 21st. So again, we're still having wildfires. They're not as, well, they are as big, it's just higher up north, so they're affecting different places, but you can see that the smoke is still dispersed pretty well all over North America. And this is from the northern Alberta fires here. And there's Manitoba. So you can see that you have an AQHI of yellow right now. Well, not today, this was September 21st, last week on Thursday. Today it is green. So here's another map that you can use to just gauge, have a forecast of where the smoke is headed. This is today, actually, this morning, from the wildfire smoke in northern Alberta and Northwest Territories. So you can see the fires, the smoke's dispersing pretty well all over Canada. This is a moving target as well. So if you actually go on this site for the forecast, you'll see that the smoke moves based on the hour, and it forecasts your the smoke exposure throughout Canada. So in Winnipeg, this is looking at September 20, well, this was done today, but looking at September 21st, you can see the AQHI was higher. This is PM 2.5, mind you, so it went up to over 150 micrograms per cubic meter, which is a pretty high concentration for daily exposure. And the AQHI was set at 5 on that day, which is a moderate risk. So here's the AQHI advice. So if you go on the Health Canada website or Government of Canada website and look at AQHI, you'll get these tables. And this is the advice. So if you're sitting at a moderate risk, and it'll say at-risk populations are general. If you have a heart condition or any breathing problems and you experience symptoms, consider reducing your physical exertion outdoors and rescheduling activities. If you're part of the general population with no vulnerabilities, then there's no need to modify your usual outdoor activities. So again, it goes from, you know, low risk to high risk and very high risk. And again, here's another table, just to it's a little bit more simplified to show that. So anytime you're very high, you want to avoid any strenuous activities, and children and elderly should avoid outdoor physical exertion. And then for general population, reducing and rescheduling strenuous activities, especially when you're experiencing symptoms. So now we're going to talk a little bit about that as well. So again, you can have this in table format for the forecasts. This is for Ontario. And this would be for Winnipeg. So they have the 24-hour forecast. Now here is the map that you can see. So the AQHI data, this is Ontario, and then a PM 2.5 data. It's mapped pretty well across Ontario. And if you look at Ottawa downtown, this is on June 7th, again, when we had the higher episodes of smoke. At one point, there was over 500 micrograms per meter cube, which puts you way above an AQHI of 10. Anything over I think is 100 is over an AQHI of 10. But you have it here over 24 hours, you have a time weighted average of 211 micrograms per meter cube, which is pretty high. Now looking at Manitoba, this is this morning, so you have a low risk so you have pretty clear skies today, it looks like, according to the maps. And this would be your data. So this is kind of the same thing as what we're seeing in Ontario. You could chart your data based on historical averages as well. So if you could see here, you had a peak on August 15th and 16th of this year, reaching as high as 191 micrograms per meter cube. So looking at exposure measurements, so what we can do also when looking at exposures or just measurement itself is just looking at the sky, seeing the difference in colors of the sky. It'll give you a visual cue of what the air quality is. So looking at plume opacity versus the MOE data, it'll help calibrate your eyes, we'll say. So if you're always looking at the data and while you're looking at the sky, if you notice a haze or anything like that and you look at the data, you can kind of calibrate yourself afterwards if you kind of know where you're placed, right? So for example, this is New York City on the bad day, which would have been closer to 900 micrograms per meter cube. And if you're seeing this, then you're really high, and you can protect yourself that way afterwards by implementing controls for yourself or other people or your workplace, right? So originally, the AQHI had a color scheme that was supposed to reflect the color of the sky, which I think was a good idea, but I'm not exactly sure why they changed it to the way it is now. But this was kind of the original scale when you went from blue to gray to a brown and then a dark brown in terms of assessing the AQHI. So symptoms, this is the next step for assessment. So you can measure your assessment based on symptoms, right? So if you can listen to your body, that's one of the most important things, I think, when you're looking at exposure, is that if you listen to your body and you're having signs and symptoms, then the best thing to do is to reduce whatever exposure you're being exposed to, especially when looking at smoke. This is more of an acutely perceptible exposure. It's not really like a chronic hazard like asbestos, where you don't really know how much you're being exposed to, and chronically, well, you can become very ill from it. When you're looking at wildfire smoke, you don't really need too much training to be able to know when your body is being affected by it, based on the different symptoms that you're getting, whether it's a cough or an irritation in the throat or something like that. Runny nose, phlegmy cough, sore throat, difficulty breathing. These are the symptoms that you're going to have when you're exposed to smoke. So if you're having any of these, then it's a good idea to get out of whatever environment you're in and getting to clean air. So while for many hazards, trusting technical instruments are more than subjective symptoms, it's common to trust that equipment when you're looking at wildfire particulate, whether or not someone is experiencing symptoms. It should be a better indicator than their personal risk rather than a measurement. So this would be included not only for vulnerable, or not only for healthy people, but vulnerable people as well, right? It'll only increase the personal efficacy rather than being dependent on experts with their expensive machines to tell you what to do and when to do it. So again, there is a variation in susceptibility to symptoms for workers, and a workplace does need to be aware of those vulnerabilities or variations, I should say. So you want to make sure that you can accommodate for the variations. Some people may be fine working in these conditions where others may not be. So having flexibility in the work schedule, or flexibility to be able to reschedule certain work or you know, high exertion work, it's a good thing. And it's also good to be aware of peer pressure. It could induce more vulnerable workers to ignore their body's messages and takes precaution. And it's good to intervene in this if the workplace does observe a behavior like this. So here are the signs and symptoms. Vulnerable workers are pretty well, when you're looking at smoke, is anyone with respiratory conditions like asthma, COPD, or COVID are examples. Anyone with heart conditions, other health conditions like cancer, things like that, or other high-risk groups like pregnant women, seniors, and children. So you can also get low-cost instruments to help measure, like actually measure the amount of particulate that you're being exposed to. Occal has these old machines that we use. If they're properly adjusted, you can actually measure PM 2.5. They're set up originally just to measure PM4, which is reasonably close. So you can use that as a quick estimate for fire smoke particulate. But if you go online now, there's a lot of PM 2.5 monitors available, and they're quite low cost. Like some are even down to $100. And you got to remember that price doesn't really guarantee accuracy. When you look at these, there's a list here on the website, and they were all evaluated. There's one from China that was, I think, $150 or $200 that was more accurate than any other PM 2.5 monitor available. And this included monitors that are worth over $5,000. So, you know, it's good to check, you know, the accuracy of these things prior to purchasing anything. And obviously you have to understand the limitations of the instrument that you're buying if you are going to go this route, and having a rational sampling strategy is important when you're looking at this as well. So this is just from a personal experience from a colleague at Occal. So he had some equipment lying around at home, and they normally sleep with their windows open, and they woke up with sinus and headache and odors in their house and sore throat. So he decided to take out his equipment and measure the air and see what we have. So if you look at when they woke up, this is at 2 a.m. In Brantford, the hourly particulate PM 2.5 concentration was, 191 micrograms per meter cube. So this is just a quick experiment that he did. So he closed all the windows when he woke up, and immediately the particulate measurement went down pretty quickly. By 6 a.m. it was down to 100 micrograms per meter cube rather than 300 micrograms per meter cube. Milligrams, sorry. So yeah, this would be 300 micrograms. And then as, the AC was turned on, the fan kicked on, and it lowered again because it's getting filtered properly. If he has a MERV 13 filter, then you're capturing a lot of that smoke. But what happened after is, as you're recirculating that air, your CO2 starts to go up, right? So that's just something that we noticed. It's so your indoor air quality is good in terms of smoke, but then your CO2 goes up drastically, and it's held around 950 ppm. And I've done this at home as well, just to see what it would be. So if you are having issues like this, it's always important to have a Venmar as well, or a heat recovery unit. An HRV, they call it. This actually brings in a lot of fresh air, but if you're bringing in fresh air, you got to make sure that you have the proper filtration to ensure that, as you're bringing down your CO2 levels, you're not bringing in more smoke. So now we're looking at exposure criteria. So what can we do when after we have our data? What are we comparing it to? So we know that smoke is toxic. It has a lot of carcinogens, polycyclic aromatic hydrocarbons is one of the major ones. Then you have metals, irritants, depending on what's burning. You have different things in the smoke. So epidemiology does confirm all this. So people suffer when they're exposed to smoke. And really you can see this just by sitting at a campfire. When the smoke goes into your face and all of a sudden you're choking, you have a hard time, you have, watery eyes, you're coughing, you know that it's bad for you. You know that you're going to suffer if you're exposed to that for long term. So the experience or the symptoms experienced by the general public due to long range wildfire smoke is quite minimal compared to those who are battling the fires, right? So firefighters are obviously right at the source. They're getting a lot more. They're not only getting the PM 2.5, but they're also getting, the gases that are emitted from that as well, because they're right at the source. But despite this contrast, those in the public who have chronic vulnerabilities may be pushed into acute exacerbations of those conditions due to these environmental exposures. So if you're a firefighter, however, with these vulnerabilities, obviously the risk is much greater for exacerbation. There have been some studies that were done. So long-term large population studies of PM 2.5 have indicated population levels increase health risks at a level as low as 7 micrograms per meter cube on a long-term average. So Health Canada suggests that there isn't really a threshold level for this. So it's suggested to use the ALERA approach, which is as low as reasonably achievable. So again, having the flexibility to move or to change the flexibility in your work to be able to move or to, give yourselves the accommodations to have fresh air all the time is important, whether you're working outdoors or indoors. So again, having that as low as reasonably achievable approach is important. So what's in the smoke? So in wildfire smoke, you get a complex mixture of gas particles and water vapors. So it'll contain ozone, sulfur dioxide, nitrogen dioxide, carbon monoxide, volatile organic compounds, and fine particulate matter. So the PM 2.5. It's not really, this is not visible to the human eye, and this is what gets deep into your lungs and your bloodstream, and this is the main risk from wildfire smoke, especially long range. In the short range, you're going to have the ozone, the sulfur dioxide, nitrogen dioxide, carbon monoxide, and VOCs, but these dissipate over time. They're gases, they dissipate, but the particulate is still there. When you see smoke, that means there's particulate. And there's no evidence of a safe level of exposure for these, for most of these pollutants as well. So to reduce your exposure to wildfire smoke, the best way to protect yourself is to reduce your exposure to the smoke itself. So paying attention to the air quality health index or any special air quality statements or other indications of smoke levels in your community. Then if necessary, limit your outdoor activity and strenuous physical activities. And if you have any difficulty breathing, stop altogether and get to clean air. So here are the environmental standards when you're looking at air pollution itself. So you have the US version, which is called the Air Quality Index. That ranges from 0 to 100. Then we have the Canadian version, which is the Air Quality Health Index, which ranges from 0 to 100. So these are multi-chemical combination standards. They're good because they simplify things for the public, but they're not very satisfying to hygienists like myself, because we want to know the number of specific exposures like PM 2.5, like carbon monoxide. Grouping them all together is great for the public. It gives you, a sign that you want, or a chart specific chart that you can follow. But often if you're more scientific and you want to dig deeper a little bit, then you can get into that with the equations. There's also the Canadian Ambient Air Quality Standard. If you look at the top right corner, that is their standard over 24-hour exposure. And their recommendation is to be below 10 micrograms per meter cube as a 24-hour time weighted average. There's also the US EPA, and they're actually talking about lowering their PM 2.5 criteria to 12.5 micrograms per meter cube. And the World Health Organization, they have the air quality guidelines, and they recommend 15 micrograms per cubic meters for a daily average, and a yearly average of 5 micrograms per meter cubic meter. So which one do we use? You know, we're not really sure which ones to reference. They're all different. Which one best suits you really is what we're kind of talking about. It's hard to tell which one is best based on a health-based value. So we need to do some research on that. So here we have the Health Effects Institute. They had a study of PM 2.5 exposure and health outcomes among 7.1 million Canadians, and they found pretty compelling evidence of harmful effects of air pollution on mortality levels below current national standards and international guidelines. So they found that long-term exposure to PM 2.5 concentrations averaging 4.16 micrograms per meter cube were associated with increased total non-accidental deaths compared to exposure at the lowest observation long-term concentrations of 2.5 micrograms per meter cube. So we're seeing, you know, already an increase at below 5 micrograms per meter, which is what the WHO yearly average is. So this is probably the best evidence to actually recommend a lower limit for environmental pollution. And the research needs to be, there needs to be more research to support the 24-hour health-based exposure benchmark. There isn't much out there to support that. So here, if we look at the map, this is based on that research. This is what we're seeing in Canada over the last, well, from 1981 to 2015. So you see the average, for the most part of Canada, it's between 0 to 2 micrograms per meter cube as a yearly average. In Manitoba, in Winnipeg here, we're sitting around 6 to 8 to maybe even 8 to 10. Northern Ontario, same thing. And then if you look at Southern Ontario, it's quite a bit higher, around the 10 to 12 and 12 to 14 range on a yearly estimate for yearly exposure. Sorry. So here we're just comparing the color scheme. So we're looking at the AQHI, and you have, you know, 1, 2, based on your PM 2.5 of 9, 10, 11. You know, you're still in the blue. And then if you compare that to the 24-hour standard, this is an hourly standard or an hourly measurement. And then you look at the 24-hour standard, you're in red when you're at 27. So, you know, which one do you use? It's pretty hard to do that. Again, this is a 24-hour measurement, so it'd be an average based on that. So throughout a day, your AQHI can range from 1 to 10, or on a good day, 1 to 3, and you're still within that range, right? Hopefully you have more under 9 in that day, but given what we've seen all summer, we've been, you know, more in the area of 27 to 37 micrograms per meter cube. So it's pretty hard to follow that 24-hour standard. So now we're looking at occupational standards. So the Ministry of Labor has an OEL for particles, which is insoluble or poorly soluble particles, and they're not otherwise specified. So this is basically just dust in the air, or smoke is part of that. And for inhalable dust or particles not otherwise specified, is 10 milligrams per meter cube. And for the respirable fraction, it's 3 milligrams per meter cube, which is the same as the ACGIH. So if you're translating this into environmental standard units, focusing on the respirable PM4, because we don't really have the PM 2.5, it's very similar. So we'll concentrate on that as a respirable for PM 2.5. This would be 3,000 micrograms per meter cube over an 8-hour time weighted average, which is 300 times higher than the 24-hour TLV or standard of 10 micrograms per meter over a 24-hour criteria. So there's a big difference here. If you translate that 24 hours into an 8-hour shift, then you're at 100 times higher, which is still over a time weighted average of 8 hours, which would equal 30 milligrams or micrograms per meter cubes, which is still very high. So this obviously puts us in a bind to explain why there's such a big difference when you're thinking of occupational exposure rather than environmental. So it makes it pretty tough. It's hard to, when you're talking to your workers to explain that they're within the safe limits when you're looking at environmental limits and they're not within the safe limits. So it's a really tricky question there, and I think that's why we go based on symptoms for the most part. So there's also the ASHRAE standard. They reference the EPA air quality standard. So this is new as of the 61.2 2022, as of last year. And it requires cleaning of outdoor air supply before introducing it to your HVAC system. And if it does not meet EPA standards, then you have to do something about it, right? So you would take a measure outdoors and then indoors. And if you're seeing that your indoor measurements are within the levels or annual averages of 12 micrograms per meter cube, then you would have to start filtering the air coming in, right? That's basically or the 24-hour standard of 35 milligrams per meter cube. I would recommend having a clean air ventilator, or like an HRV, which cleans your air prior to getting anything in an HVAC system anyways, prior to doing this. Most office buildings would have something similar to this, hospitals, libraries, things like that as well. But when you're getting into commercial and industrial buildings, they sometimes don't, right? Sometimes their fresh air is just open windows and open doors. So if you can't meet this, there's a standard there now to try and force employers to do this. So now we have health-based recommendations as well. So if you're looking at occupational health itself, there's health-based standards for particles not otherwise specified. And this is based on the Xerox animal studies that were led to the lung overload hypothesis. So based on this hypothesis and the animal study results in 1990, Xerox implemented a 0.4 milligrams per cubic meter or 400 microgram per cubic meter respirable PN or particles not otherwise specified exposure criteria. And this is in all of their facilities. And we reference this in our health-based portion of the OEL adjust tool. So I'm just going to go through that after this a little bit, and you'll see what I mean by that. We made a tool at OCal that has all the OELs for basically every chemical, and I'll show you this a little bit more after. But so there's also more recent papers that I've recommended dropping the respirable dust exposure criteria to at most 1 milligram per meter cube, and if not lower. So the thing is with these health-based occupational exposure limits are still much higher than the environmental standards and does not resolve the occupational environmental conundrum that we're in. So here's the OEL adjust tool that we have at OCal. You can check this out. We have pretty well everything. If you look at the Ministry of Labor in Ontario, we have a list of agents. We have all of those agents with their time weighted average for OEL, and you can have the you can also adjust them, right? So based on the brief and scala equation here, you can enter your daily schedule. Oh, hold on, this is health-based rationale. So you can go to the Ontario compliance rationale or the health-based limit rationale, and this is what it's going to show you. So if you have a daily schedule of 12 hours and a 40-hour work week, then you have your adjustment factor. Here's your OEL of 0.4, which is for particles not otherwise specified, and this is on the health base, you can see here. So using a brief and scala model on a 12-hour shift, this would be your new adjusted time weighted average would be 0.2 milligrams per cubic meter. So this tool is pretty useful for that. You can go through all of the agents and figure out what your exposure should be, or your not your exposure, it should be, but what your limit is. So based on occupational or on Ontario limits, and then based on health-based recommendations. So occupational versus environmental exposures. This is obviously a conundrum that provides more of a teachable moment for those in the occupational field to realize the large differences. So part of the difference is explained by the need to protect vulnerable people in the general population, which are assumed not to be in the occupational environment. So babies, children, retired people with vulnerabilities. However, it tends to ignore that vulnerable people also exist in the workplace. So about 10% of the population have asthma. And then you also have the number of workers over 50 years old with circulatory problems. That's also significant. Heart conditions, people with strokes that are still working. There's a lot of vulnerable people in the workforce, and that doesn't really take into account for this. So making the public aware that many workers have a daily occupational exposure that is far higher than the current environmental exposures, even during the wildfire season, and might bring the need for attention to this inequitable situation. So maybe we might see the Ministry of Labor start talking to the Ministry of Environment. We would hope to see that in the future. We don't really see it too much now, but that's something that would be helpful, especially for outdoor workers. It would help bring the limits down, hopefully. So again, let's look at the Ottawa downtown hourly or 24-hour time weighted average. So this is what we've seen. Like if you're looking at the Canadian Ambient Air Quality Standard, we had a 24-hour time weighted average of 211 micrograms per meter cube in Ottawa, and you would be in the red here for sure. So now we're taking that recorded or the record setting, basically time weighted average of 211 micrograms per meter cube, and let's apply the standards to it. So we're way above the Canadian Ambient Air Quality Standard. We are way above the AQHI of 10 for 95 milligrams per or micrograms per meter cube. But now look at the Ontario time weighted average, how far above it is from what the exposure was in Ottawa, which is record setting in Canada for 24-hour time weighted average. Maybe not in Canada, sorry, record setting in Ottawa for sure. And I think it might even be record setting in Ontario. And then looking at the Xerox 8-hour time weighted average OEL, which is the health-based OEL. So you're below this as well, not far, but compared to the Ontario OEL, you are very far below that just by, having the worst ever recorded setting in Ottawa. So this becomes, this is kind of where we have the 5 steps of doing something about smoke. So for people with chronic conditions, so it's a good analogy here. So reserve is a boundary between where they are at normally. Sorry, reserve reserve is the boundary between where they are at normally and where they get into trouble with their disease. So here are the 5 steps. So you can assess the exposure. So you can check out your hourly local PM 2.5 concentrations. You can look at your regional pollution with the AQHI, and then taking a reading for yourself as a good monitor. And you can also use, visual and symptom cues to guide that. So listen to your body. So assess your health reserve. How resilient is your health? So, if you're a marathon runner, you probably don't have to worry about this, although it would affect their performance for sure. But someone with severe asthma or COPD or heart conditions, they probably have a cause for concern at this point. So based on 1 and 2, what are you experiencing? If you're experiencing symptoms at all, or if you just prefer not to be exposed, what are you deciding? Are you going to reduce your exposure? Or are you just going to stay doing your work where you're at? Obviously, it has to be a continuous evaluation, because conditions can change quickly when you're looking at environmental smoke. So if you decide that you want to reduce your exposure, as per the hierarchy of controls, you want to ensure that you have a MERV 13 filter in your HVAC system. If your work area is serviced by one, if not, you can always move to an area that is serviced by one, like a library. You can also have the portable HEPA air filters. If you don't have an HVAC system or anything like that, or a portable HEPA filter, then you can wear a tight fitting N95 as well to reduce your exposure. And then you would check on the people that you know. So if you know someone has a low health reserve, you would call them, or you would check on them to see if they need help with any of these controls to be put in place. And obviously you want to be accommodating to especially to the vulnerable, but to everyone in your workforce. If they're experiencing any symptoms or anything like that, and you can't regulate anything in the workplace, sometimes it's not a bad idea to get them to, sit in a fresh air situation, or moving your entire workplace to a place where has clean air. These are things that you can do. So exposure prevention and control. So for outside work, it's similar to heat stress, so activity-based. So the more you're active, the higher your breathing rate. So the more exposed that you would be. And obviously it's responsive to hourly measurements and symptoms. So you're self-monitoring. If you want to make sure they have access to N95s, preferably fit tested and trained, but if they're not fit tested and trained, they shouldn't be restricted the access to the N95. So an N95 that's not fit tested is better than nothing. You want to have the ability to appropriately alter the activity or the location in response to symptom experience. Take breaks indoors or in vehicles. So vehicles have air filtration systems. So most of them are or they do actually filter smoke. I don't think they're HEPA, but they're definitely MERV 13 or higher. And avoid overexertion if you're noticing poor air quality. And then for inside work, you want to seal the building. So close all the windows and doors, ensure adequate filtering in the workspace. So if you have an HVAC system, make sure that there's a MERV 13 filter. And if not, then you might be better than at home. But then sometimes at home, there is no system. So what's better? You want to be at home or at work? This is something that you got to figure out depending on where the better ventilation is. You can also add portable filtering units. There's DIY units that we're going to talk about later on as well. You want to have the options for N95s if you don't have any HVAC systems in place or proper filtration. You still want to make the N95s available to your workers. And then how does this adapt to working at home issues? So if your home is poorly ventilated, you can also go to a local library, as they'll likely have a clean air they'll have clean filtered air. And if you're working or if you're traveling or if you're in your vehicle, put your vehicle fan on recirculate so that you're recirculating the air that's in the cabin itself and filtering that way. The only problem with that is that you're going to end up with higher CO2 levels. So depending on the length of your trip, if you're driving, then recirculate might not always be the best thing. So you want to have some type of fresh air coming in, but make sure that, again, your vehicle is sealed. And if you're bringing in fresh air from outside, that it is filtered and that your filter is clean. Vulnerable workers, so that includes anyone with heart conditions, asthma, other lung conditions, or precarious health situations. So you want to make sure that there's accommodations and special considerations for these people. And listening to your body is very important for this, especially when you're vulnerable workers. Like mentioned earlier, that peer pressure that people may put on because, you know, they may not know that you're a vulnerable worker, but they're telling you to work harder. Well, these are things that, you know, you need to take into consideration. Some people don't disclose it, so they listen to their body. And if they're feeling any signs or symptoms, that they stop and you allow them that break to stop. And then risk communication is obviously important as well. So what is within a worker's ability to do? And how does this compare to what they normally do or what they normally can do, right? So is there a special circumstance because of the smoke that they're allowed to take more breaks? That should probably be implemented. And then what's within the Joint Health and Safety Committee's ability to do, you know, implementing policy and helping push the worker rights and things like that are big things for Joint Health and Safety Committees. And then using that 5-step approach that we just talked about. So checking the numbers with the AQHI, listening to your body, if warranted, wear an N95. Don't wait for fit testing. But if you can get fit testing, get it. Check for MERV 13 filters if they're not supplemented. Or if not, sorry, supplement with portable air filters and check on vulnerable people. So what's the best way to protect your health is obviously to reduce your exposure to wildfire smoke. So plan ahead, stay informed. This is basically going through those 5 steps again. You want to make sure you have cool and filtered air, keep your windows closed, check-ins, reduce your exposure to outdoor physical activities, stay indoors when smoke is heavy, drink plenty of water, and offer water to those who need it or that are in your care. And then relocate if you need to. You know, you can go to local libraries or community centers, public spaces that have central air conditioning and air cleaners. So again, looking at the hierarchy of controls when you're looking at wildfire smoke, you can't physically remove the hazard or replace the hazard, but you can definitely use engineering controls with filters. You can do administrative controls. You can reschedule work at better times of the day or when you know that the smoke is going to be or won't be there. You have clean air if you're by looking at your AQHI. And you can also use PPE, so wearing N95 masks. So if you are looking at filters, you want to make sure that you go on the roof and actually check the filters in the economizer. So the economizer is what brings in your clean air on an industrial building or a commercial building. So you actually take the cover off and check in there, check your filters, because a lot of times they're dirty or they're saying that you have MERV 13 filters in there, but most of the time what we're seeing is this, which is a MERV 4, very minimal filtration. That doesn't really do anything. And since the pandemic, they've turned these economizers on pretty well at 80 to 100% to bring in fresh air as much as possible to reduce the risk of transmission. And if you have a MERV 4 filter in there, you're not filtering any smoke at all. So you're bringing in a lot of smoke if your economizers are always open. So making sure that you check those is important. So here's your MERV ratings. So you can see, you know, a MERV 4 is not very efficient. It's less than 20% efficient in filtering particles. So we're looking at MERV 13 or better to filter smoke. So if you're looking at masks, so gator mask, yeah, it's not very good. MERV 1 to 4. Cloth mask, you're within the MERV 5 to 6. Surgical masks, MERV 8 to 9, but not really. They have to be tight fitting still for that. And now you have your N95 respirators. These ones are the most efficient, and they fall within the MERV 13 to 15 range, or better sometimes, and the N99 as well. But these have to be fit tested to fall within that. These are just examples of other things. So there's also the conversion factors with filters. So you'll see sometimes you won't find a MERV rating on your filter, but there's going to be an MPR rating. So this is what it converts to. So if you want a MERV 13 filter, you're looking at an MPR of 1500 to 1900 as a MPR rating. Portable air filters. So they're not to be used in place of supplying outdoor air, to reduce heating costs and stuff like that. You're better off having your HVAC system. These are okay if you just want to supplement, right? They also need to be sized appropriately, taking account for noise as well. And they need to be maintained, because if they're not maintained, they'll eventually put out more particles than they actually take in. And the filters age, they lose their electrical properties for particle collection. So things to watch out for when you're buying a portable air filter is the clean air delivery rate. You want to make sure that you have a clean air delivery rate of 70 CFM per 100 square feet of floor space, and the maximum noise level. The recommendation for background noise is 40 decibels. So if you have something, around the 56, is still pretty high, but it's more manageable. So this is a do-it-yourself air cleaner. So they call it the Corsi Rosenthal box. If you go on our website here at ocal.on.ca and make your own air filters, it'll show you step-by-step on what to do and how to do it. They're very efficient. They work well. They may be a little noisier depending on the fan that you buy than a portable air filter, but they actually clean better than a portable air filter. So just food for thought. You can build yourself one for a lot cheaper than buying one. So face masks for wildfire smoke. So obviously the best way to protect yourself is to seek clean air. So portable air cleaners at home, filtered air, relocating to an area with less smoke is important. Again, a well-fitted N95 is the best thing for protecting yourself from fine particulate matter. So being fit tested is great. If you're not fit tested, it's still better than the other masks that are out there, unless you have a full face respirator or something like that. So here you have a list of what it looks like. So if you're not fit tested, you're still capturing 80 to 90% of PM 2.5. And then if you have a fit tested N95, you're 85 to 95%, and then elastomerics are 95% to 100%. So you have quite a bit of choices here and in terms of masking, but N95 and up is obviously better, and it only works if it's tight. So if it's not tight, then you're gonna have a lot of leaks in your respirator, and it's not going to work properly. You're not going to be capturing nearly as much as this 80 to 90%. If you're not fit tested, you'd be closer to what a surgical mask would be. And even surgical masks need to be tight in order to capture this amount of particulate. So again, this is only surgical masks with braces. So the regular surgical masks, they don't really help. They're all wide open. Even if they're tight, there's a lot of leakage. So it doesn't really help too much. So here's, this is Ocal's infographic, just few parts of it. I think we're going through all of them here. So this is kind of what it looks like. If you want anything with it, it's on our website. It's free. You can go print it off and hand it to your workers. It gives you a lot of good information on prevention and knowing your symptoms, employer responsibilities, identifying hazards, using your hierarchy of controls, and your AQHI is at the back as well to identify your health risks. So special thanks to Leslie Skynes. She did all the graphic artwork for the infographic, and she put this together pretty quickly for us during the peak wildfire season there in June. So we were able to inform a lot of Ontario workplaces with this. So thank you for your time. If you have any questions, I'd be happy to answer them. And if I can't get to them now, then you can send me an email and I'd be happy to answer any questions you have.
Thank you so much, Andre. Really great informative session. We appreciate that you provide all your knowledge and your resources from OCal is really great sources you could search for. So will the presentation be public? Yeah, we are going to send the slide to the participant. So there was one folks asking, would you recommend carbon filter N95 respirators?
Well, the carbon filter really just filters for smell, right? Are you talking about something more for gases itself? You don't really need it for N95 respirators. If you're, yeah, I'm not exactly sure because usually carbon filters are on elastomerics, not really N95s. Like N95s are the paper filters, which are fine. That's all you need to filter particulate. If you want to filter gases, then you would go into a VOC or a different type of cartridge for that. Okay, so you do have them for N95s. So you don't need them for vapors unless you're closer to the fire. Long range fire or wildfires, you don't really need it, mostly because of that, right? You're far enough by the time that the particulate reaches you, the vapors and the gases are dispersed. Yeah, that's basically it for that. Any other questions? That looks like it's it, right?
Yeah, so far. Do you have more questions for Andre?
All right, if you do have any other questions. Oh.
Yeah, this is the last one coming up. Are you aware of any work related to protecting wildland firefighters?
I'm like work-related research or just work-related protections. I would say, wearing a mask, like an elastomerics mask with vapor cartridges would be good, or even an N95 that control vapors as well wouldn't be a bad thing. Firefighters do have PAPRs and full-faced, oxygenated masks. I'm not sure. I don't think wildland firefighters have them too much, but I think they have access to N95s. So again, you got to look at their symptoms and things like that, right? A lot of them wearing N95 feel it may be restrictive. But if they're working in that level of particulate all the time, it wouldn't be a bad idea to protect your health. So it comes down to a preference thing as well sometimes, because there's no tolerable limit. It's you use the factor of Valera, which is as low as reasonably achievable. So if you're a firefighter and you're right at the front line of it, obviously you want to protect your health as much as possible. So if it was me, I would probably wear a mask. And if I'm in, like, this is for wildland firefighters, like firefighters, regular firefighters who are going into burning buildings, then you have a lot more of these gases, a lot, like, different things burning, a lot more H's. So then you're wearing, you know, a full face respirator, and it's supplied air. So yeah, I would stick to that.
Awesome. I think there are no more questions. So later on, if you think of anything you want to ask Andre, you could shoot him the email, right? So yeah, on behalf of the Occupational Health Center, thank you, Andre, to doing a really, really great presentation. And thank you all of you, your participants, you know, to participate in joining this session. So the session is already recorded, and then we share to the our website on the social media too as well with the slide. So thank you. Hope you guys all have a great afternoon.
Thank you.
Thank you.
Thanks for your
Bye.
time.
Take care.
Bye.